Tyler, the questions I have regarding possibilities for the 3D models are, in standing, if I lift my left thigh up to 90, what happens to the pelvis in three-dimensional space? Okay, and what happens if I then separately bring it all the way up as far as I can actively bend it? Is that any different? What if I take the leg behind me into extension? What happens to the pelvis? And what happens if I abduct the left hip? And then what happens if I adduct the left hip to an end range of active movement? And then what happens to the pelvis if I rotate my foot outward? My foot is not weight bearing on the left, so I point the foot all the way out and then point the foot all the way in. And then the reverse of that, so another aspect would be to look at what happens if we're only weight bearing through the right leg in standing, okay? What happens if I lead the movement with my pelvis? So I'm going to bend the pelvis forward at the hip. So I'm keeping my spine straight, so the motion is happening at the femoroacetabular joint. So there's flexion of trunk on pelvis, and then I'm leaning backwards. So that takes pelvis into extension on the hip. Okay. And then what happens if in standing only on the right leg, I then introduce left elevation of the pelvis, and then the pelvis dropping down on the left. And then I'm unweighted on the left. Left knee is bent 90 degrees. What happens then if I twist pelvis left and then twist pelvis to the right, and the foot stays planted on the right? So I think those are very worthwhile projects. We can talk about their utility. Most studies, actually all of them, in looking at hip rotation, evaluate the person in sitting, and they internally rotate the thigh or they externally rotate it, okay? Not very functional. People hardly move their feet that way in sitting. They certainly don't do it both ways. I mean, they might cross over for comfort, but they certainly don't go the other way. And it just I never understood why that's the way they test it, or else they do it with a person laying on their stomach and they bend the knee to 90 degrees. Just pretend I'm laying down. You bend the knee 90 degrees and then you rotate internally and rotate externally, okay? What's really functional is that people need that little small movement of rotation when they walk. So I'm a fan of testing it in this, in this context with the knee straight and the hip in neutral as well. And I do that with the person laying on their stomach. So I just roll the tibia and femur in, and at the end range I spring it. So I think it would be valuable to look at those motions with the hip and knee straight. Let me look at my notes. And then the third concept is weight bearing on both feet. What happens if I flex the trunk forward, or rather I'm flexing the pelvis on the femoral heads, and for me that's my end range, and then going into extension, okay, and then going into side glide to the right, side glide to the left, okay, and that obviously couples motion of the thighs, and then also the femurs, and also of pelvis moving with them, and then left rotation, and then right rotation. And then if I bend my right knee, then it becomes an oblique movement, okay? And then if I bend the other one, okay? Those are my thoughts. And I do the log roll test. It just makes a world of sense to me. But I also do a anterior spring on the back of the trochanter. And that would be a fun one to demonstrate on a 3D model. And I think that that test is standalone because I will find restrictions in that forward springing of the trochanter. I'll find it to be stuck, and the trochanter seems to be more posterior than the other side, and after I treat it, those things normalize. And I have a feeling that the movement inside the hip joint is a little more complex than just pure internal rotation, but that's something that we could talk about. So those are my thoughts for now. We can chat it up, and I can also bring the model in, and I have other models that are easier to manipulate than this big guy. So thank you very much.